kind of like got my stuff. Okay, I think we got it together now. Good evening, everybody out there in Chester County, Coatesville, and on my Facebook page. Doggone it. It is a Wednesday, it is hump day, and this brother Fonz coming to you straight live from City Town Talk, man. I'm telling you, I'm going to shut this music down a little bit, although I love my theme song. But look, I just want to take this time to say good evening to everybody. It has been a minute, so I'm going to give y'all a minute. I need y'all to go to your iPads, your phones, and I want you to hit the share button on this, what we're getting ready to do, because I have a special guest here. His name is Walter Murray, and we're going to talk about some stuff that we rarely ever want to talk about, and that's cancer, colorectal cancer. That's right. We're going to get up in there because it is so important. I'm going to give y'all a few moments because I do like to meet and greet everybody. Y'all know how I do. And so important. Actually, Wednesday, Walter, is an odd day, so people don't normally just jump right on. Normally, I'm on Tuesdays, but we had all kinds of meetings yesterday. But I'm just so glad I have this opportunity to greet you. So look, first of all, Walt, why don't you say good evening to everybody and tell us a little bit about yourself? Not too much, but a little bit.
Well, I just want to say good evening, and I thank you for this opportunity. First of all, foremost, I thank God for this opportunity. I am Walter. I am a native of Philadelphia. Currently, I practice as a mental health nurse in the VA of Coatesville. My specialty there is substance abuse, substance use disorder. I do have a very strong background in mental health. Been doing mental health for about 15 years as a nurse. Started at University of Penn, and then like I said, I moved to the VA. I'm also a professor. I teach at Wilder University, and my specialty areas there are mental health and health promotion. I am married, and I do have 3 beautiful children. One is in the Air Force. Kudos to him. Him and his wife just had their first child.
Man, you said all that stuff. I feel smarter already, man. I feel like I know stuff. Hey, but I'm glad you talked about the mental health issue, because I'm gonna jump all around my piece of paper here, because we might as well just jump right into that. Mm-hmm. What's going on? It seems like nobody ever paid attention to mental health issues, but now it's coming very prevalent and it's very out in the open. Is there something that's making this more widely recognized now, as opposed to like before?
Well, I think that what's making it more recognized now is the fact that people seem to, our society is embracing it more. Mm-hmm. Patients are feeling a little bit more comfortable. And not only that, we all know that when Hollywood is involved, especially when you have individuals who suffer with mental illness on the what I would consider the celebrity side, and then they get to publicize and express themselves and the health issues that they have went through. So it kind of like opens the door for, us to, get more aware. Not only that, to be more comfortable in talking about it. It reminds me when AIDS came about. When I was a kid, I remember when AIDS had hit the mainstream. People were talking about it. There was funding, but it appeared that that disease had been around for a very, very long time. But until it hit the Hollywood circuit of some famous actors, then it was like it became like sort of like well known, meaning that from the standpoint of what is it, what does it do, what are the treatments, where does it come from, and so now when you think about research in regards to AIDS, and then also the support and the monies that went into that research and the treatments that are out there. Now individuals feel comfortable in, you know, with their situation with that medical condition of AIDS. So I look at mental health the same exact way.
Good, good. Hey, look, we'll take a pause for the calls right here. I want to say top of the evening to Danita Nicole is watching. Danita, thank you for checking in. Dwayne Norman Sr., Cynthia Butler, Courtney Levon, the man with the plan. Sharon Sissy DeShields has checked in. Hey, top of the evening to y'all. My guest this evening is none other than Mr. Walter Murray, and we're going to be talking about colorectal cancer, CC. That's right, not Canadian Club, not that whiskey that we used to drink back in the day, but colorectal cancer. And this is something that a lot of us choose to try to ignore, don't want to get the screen in. We, you know, like, don't ask me nothing, I don't know nothing at all. You know, we're going to just dispel that myth, and we're going to talk about this in depth for the next 40 minutes because my chicken wings is getting cold, but we're going to talk about some stuff. Now, first of all, you don't always want to know about who I'm talking to, but Walter so adamantly, he just gave us kind of his backstory and everything like that. But let me ask you, now, dealing with men and our health issues, especially Black men, what do you find what do you find where we have our problem in going to doctors and getting treatment and getting scanned and things of this nature? What are our challenges?
Interesting that you say that. You're actually interesting you ask that question. In my profession, especially when it comes to mental health, and then before I was, you know, mental health, did a lot of health promotional activities, and you know, especially when it comes to diabetes, cancers, hypertension, and all of that. And this question does come up, and you know, and I have talked to a lot of men in various communities, and I find that one of the challenges is that it's a level of comfort and who they're comfortable with. Not only that, another challenge is that with us, if nothing is going on or we don't feel anything, I don't need to go to the doctor. I don't need to waste a work day spending time at the doctor just to get a checkup. It's almost like if it's not broken, then we don't need to deal with it. We don't need to look at the issue. But however, there are a lot of things, particularly even with hypertension, which is called the silent killer. There's a lot of things that are going on within our body. And if we take that time and that effort and say, you know what, I need to get checked out. I need to, you know, embrace preventative health care. I need to listen to health talks like this, get something out of it, and, you know, and spring forward. But again, like in answer to your question, I think that the major barrier is with us is that first, if we don't feel anything, if we feel like we're okay, we're going to keep on pushing and pushing and pushing that motor. Even when it comes to working, some of us in our communities, but particularly African American communities as men, we work in 2, 3 jobs just to support our families. And so we just don't have time. And then if a lot of times when we are forced or we tap into healthcare, it's like we feel that sense of that uncomfortable because most of the people that are in healthcare or professionals don't reflect us or reflect who we are. Mm-hmm. And so there's that trust factor. Another factor is that, you know, when you think of Tuskegee and the things that happen in research with us, we're just not too cool about embracing, you know, the medical community. So I think that those are some of the things that hinder us.
Now, Walter, give me 30 seconds because right now I feel, wait a minute. This is something that I rarely ever do, but I feel pretty comfortable to do this because I want to talk about this for a second. Mm-hmm. Hey, Tina, it is good to see you. Brother Fonz just went and grabbed a couple of chicken wings, and I never eat on here. But you know what? My show is not for form or fashion. I'm feeling real comfortable because I myself was diagnosed with liver cancer last year. And I went through and did a liver resection. And had I not went to the hospital for something else, I would have never known that I had liver cancer. So here is the dilemma for me and possibly for others. How do we get doctors to give us the type of screening and x-rays and stuff like that that will find things like this? Because had I not went there because I was throwing up, had diarrhea and a stomach virus, I've never known I had liver cancer.
So how do we get the medical community to, you're asking that question. One way is that we have to, as a medical community, particularly the nursing community, we have to put ourselves out there in the community, in our own communities, where we educate, where we teach, where we provide health promotional activities. Like for instance, I do blood pressure screenings in the community. I've done them at barbershops. I have also done them at community health fairs. So it takes us as healthcare professionals to sacrifice our time outside of our working hours and really embrace our own communities, embrace those cultures within our communities, being culturally sensitive, and basically educating. I think that education is the key. I'll give you an example. I had one gentleman who, just like you, had a health condition. So I go out and see him, doing a home health assessment and care, just to care for his wound. But I noticed that he had a cardiac issue in his diagnosis, in his treatment plan. And, we sitting there talking, and I said, listen, did anybody ever talk to you about, your diet? That you can still have those tasty foods that you really like. And I got down to the nitty gritty with him. I said, I'm being for real, soul food. You can still have soul food, but you have to cook it a different way. And he was blown away. He was like, nobody never told me that, so I just go and I just don't listen. I just do what I want to do because I feel like they or the medical community don't look like me, so they don't understand, what I like and the things that I like to, do as far as my lifestyle. And when it comes to, our diets and, those special foods that we like. So I just think that we have to, particularly nursing and other healthcare professionals, have to put ourselves out there in our communities and really take that charge in education and health promotion activities.
Hey man, thanks a lot. Look, and you're talking about food and all soul food and all that, and I got the nerve to be picking up a piece of fried chicken.
But that's okay, brother. It's okay, as long as it's fried in the right stuff.
Yeah, and this is my first fried chicken in about 5 or 6 months, so I'm really showing off. Patrice, prior to the top of the evening to you, Patrice, I have none other than Walter Murray. We're in here. We're on it, and we're going to lead into colorectal cancer, but we're talking about because Mr. Murray here, he's so diverse and a lot of stuff. Now, how long have you said you've been in the medical field?
I've been in the medical field for almost 20 years.
Wow, it's a long time. Okay. Now, let's talk about, I know there's some upcoming events during Juneteenth where they're going to be doing colorectal screening. Let's talk about colorectal cancer. And if you got any kind of slides or anything you would like to show the viewers, this would be a great time to do that. And wait, because I don't really know how to do some of this stuff, right? Share button, let me see. Multiple participants can share simultaneously. I'm gonna click that button. And when you're ready and everything, you're looking all excited and everything, man, show the viewers what you got, what you're working with.
I got you, brother. All right, so let me just pull this over. I'm going to share my screen. So I thought this was interesting. I pulled this, and I hope that your viewers can see this. I'll share, and I'm pretty sure that they can see that. So we all know who this actor is. And it goes back to what you and I talked about earlier in regards to us tapping in and knowing health conditions and how does it come to the mainstream. So when you look at this particular individual, God rest his soul, here's a person who died basically of colorectal cancer at a very, very young age.
Yes.
Interestingly, when when individuals found out, because he's a well-beloved actor, especially when he made the movie Black Panther, it kind of like, I feel like it kind of like spearheaded us as a community, particularly African-American men, to say, whoa, wow, look at one of us. What actually went on? So that allowed us to possibly dig a little deeper in our own issues, trying to understand what colorectal cancer is. Some people have never heard of it. So again, when I look at this, and I was, so here's some interesting facts that I wanted to pull out to you all. So when you look over here, as I highlight that, Black adults and colorectal cancer, highest rate of any racial ethnical group in our country. 20% more are likely to get colorectal cancer than any other groups. That's huge. 40% more likely to die of it than other groups. So I thought those numbers were kind of like interesting. And I think that it's important for us to really target this. Why are Black people more likely to get colorectal cancer and die of it?
That's my question.
Yes. So there are many reasons. One of the reasons I would say they looked at is our diet. We typically have a diet that's low in fiber and high in fats. And so, which can cause lots of issues when it comes to the digestive tract. Also, when you look here, looking at some of the science, the reasons are complex. But like it says, research suggests that most important factors, it is this disparity, our access to high quality screening. That's another thing. So when you talk about high quality screening, you're talking about colorectal screenings. And do we know about them? Do we have access to them? Do we understand what that means? And when you particularly think of the African-American community, particularly where I grew up at in poverty, that's very, very difficult for us. And so that's why when you have this initiative that we are doing, these free screenings, it's sort of like kind of like spearheads, jumpstarts that interest, in a lot of our men, and you go from there. And here again, what are some of the barriers to high quality screening and care that Black adults may face? Things that stood out to me in this particular reading that I found is that there can be many, sometimes doctors and other healthcare providers don't take opportunity to urge people to get those colorectal screenings when they are seen for other reasons. So here again, education. Here again is making patients aware. Here again is getting out as healthcare professionals in the community, and really, putting this to the forefront. And our people need to see more people like us. I did a study one time with in one of my doctoral studies, and I posed a question, and I asked the question. I said to my cohort, my colleagues, I said, listen, what if you had a healthcare system that was 30% African-American or minority professional, 30% Caucasian, 30% of other ethnical groups? That includes nurses, doctors, healthcare, CNAs, techs. The list goes on. Even, I would even say, even in leadership. When that person enters into that healthcare environment, they are more likely to feel more comfortable. They are more likely to get some understanding, and they feel like that those who are delivering that care have that understanding, as opposed to when we walk into many of our healthcare institutions, you see possibly 70% Caucasian, maybe 10% of other group, and maybe like 15% of minority. So I think, again, that's important.
Hey, thank you. So let's take pause here. Shalia Hardy, it is good to see you this evening. And Patrice Proctor said free screening is great. And Patrice, we got some free screening coming up. Matter of fact, they even want to kind of like throw a gift card in there. We're going to talk about that though. But look, so all right. So now you're coming to Coach, well, not coming to Coach. Do you live in Coachville though? Are you still?
Well, I live in Lancaster. I just moved to the Lancaster County, but I did live in Coatesville for 5 years.
Okay. Mm-hmm. All right. So now we're going to have this screening thing during Juneteenth. You want to share with us what's going on with this screening and all that stuff for us?
Sure. Let me pull that information up if you don't mind.
Man, you got some more stuff?
Yeah.
Man, you're amazing.
Well, I try to be prepared.
Hey, yeah, I don't blame you. Yeah. Sure. Somebody got to look like they got some sense of them.
Let me just pull this up. It's going to not take that long.
And to you viewers out there, I hope y'all hit the share button, because this is some good information what we're talking about. We're laughing and joking, but this is very good. I'm telling you, when you get diagnosed and you hear the C word, man, it's not to make you freak out. So it should make you want to be forewarned is to be forearmed, as they say. Early detection is the key. So we got to keep getting tested and checked out, man. I'm telling you, I know I'm going to do it from now on. Scared the bejesus out of me. And it's only because of the grace of God that I had a liver resection and I didn't need any chemo afterwards. So.
And here we go. And if everybody can see this right here. So this is our drive. It's going to be June 18th, 11 a.m. to 3 p.m. And the location is going to be at the Jubilee Ministry on 920 East, Lincoln Highway East in Coatesville, PA. This is spearheaded by Penn Medicine, partnering along with organizations, W.C. Atkinson, Jubilee, my organization, which I'm the vice president of, Minority Nurse Educators of CHESCO, and us, Digestive Health. And again, it's a drive-through or walk-up, free at home colon cancer kit. And then also you will receive a $20 gift card for returning the kit. We also going to have free blood pressure screenings. And we also going to have some giveaways. So again, we want to tackle this block by block, neighborhood by neighborhood. Here's some other facts that we put on our flyer for individuals to kind of like spearhead their interest. Did you know African American and Blacks between the ages of 45 and 75, this is very, very alarming, more likely to get or die from colon cancer. Colon cancer is easy to treat if found early. So there is a test that you can do at home. And just so you'll know, this test that you do at home, you get your results. Those results will kind of like spearhead you to either do more in-depth with your primary care physician or a gastroenterologist. So there should be referrals for that. And this is how you register for your screening kit. We have this barcode here. You can just kind of like put your phone, take a picture of that. We'll lead you right to the site, or you can call us at our service center. Also, so again, how you participate, register in one of 3 ways. You can do it by phone, computer, or call the Atkinson. Answer the questions. There's a video. It takes about 20 minutes. Pick up your kit. Saturday, June 18th, between 11 a.m. and 3 p.m. Step 5, follow the instructions, very, very simple instructions on the card in your kit, and then return your kit to the Coatesville Library. Get your gift card in the mail, and then someone will contact you with your test results. And this is what I like. This is the best part of this. Medical insurance. You don't need it. This is all,
got it.
yeah, this is all free. And so, you know, when you think about when you're doing this test, it may be uncomfortable. But again, when it comes to our healthcare, there are some examinations, there are some things that are uncomfortable. But again, that uncomfortability can save one's life. And the uncomfortable thing is with this kit, of course, there's a stool sample that will be involved in all of that. So that could be sort of dicey for individuals, but I just like to encourage you that try not to look at it that way. Look at it the fact that, hey, look, based on these numbers, I really want to get screened. I really want to get myself checked out, because if this is something that I could avoid, I could avoid by all means. I had my colorectal screening done with a gastroenterologist. I was so glad that I did get it done at the age that I did. Didn't find anything but a few polyps, and he was able to remove those polyps. And so polyps in your colon is can be an early sign of extra tissue growth, which can turn cancerous. So when they find out and they do these screenings, and then they go for an in-depth screening just to make sure that there's no polyps there, they can get rid of those small polyps early, and then they'll let you know when you're due back for your next colorectal screening.
Doctor, let me ask you a question.
Go ahead, brother.
Digital exams, are they accurate, or should you do both? Or
okay, so stepping into another realm, we're talking about prostate cancers,
okay,
or issues with the prostate. And I'm glad you asked that question. Let me just stop share here. I'm glad you asked that question, because this is something really, really big in our community as African American men. There are many of us who have gone on, who have passed away, and the major cause of that was prostate cancer or prostate issues. The digital rectal exam, which you're referring to, the DRE, is a sort of a pre-definitive test for the doctor, where he goes through the rectal with his finger, and he can be able to feel any abnormalities in regards to the prostate. Only men have prostates, women don't have prostate. So when he feels going through the rectal area and feeling the prostate, and if there's any abnormalities, I should say, then he will do what is called a PSA test, which is a blood test. And based on those numbers, if those numbers are elevated, especially if there's abnormalities with the DRE, then there's more extensive testing, and then there's more treatment. But it's important for us as men to take prostate cancer very, 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 very serious. I find that it, for some of us, and I've talked to a lot of our brothers, they feel that it's an inhumane way of testing someone, because let's be for real, the doctor has to put on a glove and stick his finger up your rear end. And a lot of us, we ain't cool with that at all. But the thing is that it's very, very important, especially for us between the ages, I would say even between the ages of 40 and 50, that we should get that done.
Let me stop you right there for a second, because Patrice has a question. She wants to know, if you had a colonoscopy recently, do you still need this test?
I would say based on your results, let's say if you had a colonoscopy I would say probably within the last year, 2 or 3 years. It wouldn't hurt to get this test because there could be some changes, but based on the results of that test. So let's just say that you got your test done, the doctor gave you your results, he possibly have, or she may have removed some polyps. Basically, they'll say based on what we saw in your exam, you need to come back within 5 years, or based on your age, you need to come back within this particular time frame. So getting this free kit does not hurt anything, but for those individuals who have had these, the colonoscopy done recently and their test results were pretty good, I would say this is not needed, but it doesn't hurt.
Okay. Hey, Kay Jordan, it is good to see you this evening. Our guest is Walter Murray, who is into everything in medical. I mean, he's just a warehouse of information, and we're talking about various types of cancers. Colorectal cancer. He will be in town on June the 18th, giving away some free colorectal kits. Now, how often should a person take this screening?
So this is just a screening, and this is like a pre-screening, and it does give some valuable information. And what this kit does, it's sort of like when you send it back, they can test for all sorts of things, particularly blood in in the stool, other things, any sort of like abnormalities, and then based on those results, then a person will be basically told, hey, look, you need to follow up with your primary care physician, go see a gastroenterologist. So let me also say this, very important. This kit that we are doing does not determine or give the diagnosis that you have colon cancer. Okay, so that's very, very important. There are other things that have to go along with this. This is a more like a pre-screening. Pre-screenings for anything like a blood pressure is a pre-screening. So it kind of like gives us sort of like a baseline, gives us some interest, gives us some activity as far as health prevention, health promotion, just to get the ball rolling.
Okay, so all right. So now this, as a veteran, how does veterans, say like a veteran want to get a CAT scan or a body scan so they'll know what's going on inside of them? Is there a way that can be requested through the VA?
Yes.
Yes.
Yes, I work for the VA. So yeah, you can, with your doctor at the VA, especially if you have a VA doctor, or if you have a community, we call it community care, which the VA allows our veterans to choose primary care physicians outside of the VA. And there's paperwork. I wish my wife was here because she actually works in that department. But the thing is that those things that can be done where they can come on site and get those scans or radiology studies. However, when it comes to colorectal screenings, colonoscopy, that's different from a CAT scan or whatever you want to call it. They actually go down with a scope into the colon and basically do their diagnosis that way. Can I just show you this picture?
Man, show me some pictures. Come on. My chicken getting cold anyway, man. What you got?
All right, here, let me share. So I just wanted to kind of like, give some education on what the colon is and its purpose. So as you can see right here, this is the colon, which is the large intestines of the human body. And this colon actually is responsible for storing a waste product, which we call fecal matter. It produces that and it kind of like stores it. And then that way it could be moved out of the body as it's supposed to. The issue with this is that, and they find that particularly in our diet, when there is not enough fiber let's say there's lots of fats, sugars, and things of that sort, things can get kind of like backed up. And not only that, there could be some other issues that go on with in the colon. So I find that what I learned from my gastroenterologist, and him being African American, I really felt comfortable talking with him. He really highly suggests for our community, you have to be mindful of having a nice fibrous or fiber included within your diet, because fiber was help move and keeps the colon clean. So I just wanted to show this picture so all your viewers can see what the colon looks like, and why. And here's another picture inside the colon. You can see that this is as seen right here, colon cancer as seen during a colonoscopy. And then you can see that extra tissue growth that's growing in the inner, and then it starts to spread if they don't treat that to the outer. And so therefore, that becomes kind of like detrimental. So
Well, let's talk about that fiber. Let's talk about, where do you find some good fiber? What do you suggest as far as
so hey, listen, you all heard this. I've heard it all my life. I'm 56 years old. The famous saying, apple a day keeps who away? The doctor away. So, and that's very, very true. The apple is like one of the most fibrous fruits that we can consume. There are individuals that have done colon cleanses, colonics, and that's all well and good, because I just think those are just band-aids. But I think that you have to kind of like develop a lifestyle of keeping a clean colon. And I think that when you think of fruits, particularly apples, certain vegetables, nuts, grains, incorporating them on a daily basis in your diet, you will start to see some changes, particularly your bowel movements will be more regular. Not only that, it won't be strenuous. They won't be in broken fashion or in balls, or that's the best way I can explain it. But you'll be, your bowel movements, elimination would be, sort of normal. So, but that's a lifestyle. That's a lifestyle that one has to, be mindful of and adapt to that, just to keep their colon clean.
It's good stuff, man. It's pretty good. This time has gone by real quick too, and I think you answered almost all my questions on here. And now, once again, when will this cancer screening event, when and what is the time of that event once again?
Yeah, sure. Let me pull that up. I like to just make sure I have the facts here.
Bernadette Runner, it's good to see you this evening, Bernadette. Hit the share button on this as he shares all this good information.
Let's pull this up here.
Got some Star Wars there in the background, don't you?
Yeah, I am a huge Star Wars fan.
So now there's isn't there some sort of something that they're streaming on Netflix now, Obi-Wan Kenobi or whatever?
Yes, Obi-Wan Kenobi. It's very powerful. I'm really enjoying it.
Oh, you already saw it. Okay. That's good. That's good. I may look at it,
Yeah. So again, here we go. Again, the event is Saturday, June 18th, 11 a.m. to 3 p.m. I will actually be in the Coatesville area with a table set up, and I could actually send that information to you, where I will be passing out flyers and just talking to passerbyers as what we are doing. So I will be setting up, my first station will be in front of the library, or in that area. I'll have a table set up with these flyers. Individuals can come up, they can talk to me about it, get the more information, which is actually on the flyer, take their phone, scan the code to register. Again, there are 3 ways of registering, as we see here.
And while you're scrolling through that, Walter, maybe you would like to set up a table at our carnival. I have a carnival, not I, but we have a carnival coming for 5 days during this Juneteenth week, June 14th to the 18th. So if you're interested in that idea, I just finished talking to Mrs. McNeil in regards to that, and she thinks it's a great idea.
Oh, that would be a splendid idea, because again, this is a very, very serious health condition. And the more we put ourselves out there, and really the best we can do is saturate our communities with information, especially when we have a product that's free to the communities, the screening. Yes. So yes, I'm excited about coming to the carnival and setting up my table.
All right, I'll get in touch with you after we get offline here. Okay, so go ahead and take us on in, and then take us on out.
Okay, let me stop share. All right. So again, I just want to thank Brother Alfonso for having me on his show. Touched on a lot of things in this very short period of time. I hope that I can come back and, address some specific topics, particularly like hypertension, which is a killer in our community, and also the prostate issue, which is another silent killer in our community. I look forward to having as many people, getting people registered for our colorectal screening efforts, and look forward to seeing you all.
Good stuff, good stuff. Hey, look, I'm looking forward to us coming together again. Definitely going to have you come back on here, because we don't have enough people in the medical field talking to people in our community in regards to medical issues such as this, especially issues that affect the black man more so than any other race. You know what I mean? We really need to hear it. We need to hear it, man. Especially with it.
Yeah, my passion is mental health. So I would love to talk with and bring other individuals on to really help us as a community and to embrace these conditions of mental health.
Okay, and here's from Patrice Proctor. You may not know her, you may know her, but she, and Patrice always gets your title wrong, and I know you don't go by titles, but she's the head supervisor up there in Valley Township, whatever they call her. She's the top person with that. And they're having Valley Day, which is one of the biggest community events out there, man. I mean, thousands of people wind up there. She said, I will need him for Valley Day for medical tent. I will be in touch. So she will be reaching out to you. Patrice Proctor, everybody knows her. Mrs. McNeil knows her. Everybody knows everybody. So that will be an excellent opportunity once again.
Absolutely.
Word out, man. So, man, I'm telling you, this shows something else, ain't it? Every once in a while, something good comes out of it. So look, man, I just want to say, I want to thank you for and thank you for allowing me just to sit and talk with you for a little while. Share your knowledge and your expertise with all the viewers and everything. And I prayerfully, man, that we will get together again soon, and your words don't fall upon deaf or deaf ears out here.
Yes,
man. This thing is important. I know it's important to me, so I'm getting checked up every chance I get.
There you go.
Patrice, okay, he's on the radar. Patrice, you got him from here on in, but we're going to share him all throughout Chester County, because we die and we perish for a lack of knowledge.
Absolutely.
Okay. Hey, look, all my viewers out there, I want y'all to have a great day, great night, whatever. I want y'all all to know that Coatesville is rising. And if nobody's told you that they love you today, man, I definitely love y'all. So I want y'all to have a good night, and we'll talk soon. Walter, thank you very much, man. Have a great night. Having me. We will talk soon, okay?
Thank you for having me.
God bless you, and peace out.
Peace out, brother.
Bam.